My name is Josh Bintz, and I'm the physical therapist here at Miller Orthopedic Specialists. Today I wanted to share some information regarding athletes, specifically athletes that are going to be looking to return to sports as the restrictions related to coronavirus ease a bit. Whatever that might look like, whether it's this summer, this fall, this winter, athletes are going to get back on the field, on the court at some point. And what I wanted to talk about today was what we should expect that to look like. Athletes have taken more time off. They've been away from their coaches and trainers more than is typical, especially more than is typical leading up to their upcoming seasons, especially at the collegiate and professional levels. Most of those people have not been away from their coaches and trainers this long in a very long time. They usually have constant access, guiding their workouts, guiding their diet programs, all of these things, and that has been restricted significantly during this time. Between altered off-season schedules, between potentially shortened postseasons and altered game schedules, competition schedules, we're going to be going into seasons that look very different than what we've ever seen in the past. And what we need to keep in mind is the way that we bring these athletes into these seasons also needs to look different. If we look back at times that we could compare with what we're going through right now, for example, the 2011 NBA and NFL Lockouts, the numbers of Achilles and ACL tears that occurred in the seasons following those lockouts, when athletes were away from their coaches and trainers for extended periods because of that situation, the numbers of ACL and Achilles injuries were astronomically higher than what we see in typical seasons. ACL and Achilles injuries are two of the longest rehabs, two of the most substantial injuries that an athlete can suffer that could potentially derail a career. And we don't want anybody to suffer that injury, so any increase in these types of injuries should be a little bit alarming to coaches, to trainers, to athletes themselves. And so when we bring these athletes back into practice, when we bring them back into workouts, we need to be mindful of that needs to be on our minds, that we don't want to lead into seasons where we see increases in ACL and Achilles injuries or whatever injury might be more related to your sport. So if you want more information about this, if you want some potential advice, some more numbers and things to think about related to this, go ahead and click on the link that's along with this post. If you have more questions beyond that, feel free to give us a call here at Miller Orthopedics. We're always here for you. We are still open at this time, although we are following some of the coronavirus related restrictions that kind of alters how we do things around here. But please don't hesitate to reach out, click the link for more information, and we'll see you guys back on the field soon.